In this section, we will be taking a look at the concept of healthcare systems once again, but specifically with the exemplar of disaster preparedness. So the objectives for this section are centered around emergency response, developing an emergency plan, and then also looking at bioterrorism. And then we will be looking at the student learning outcomes of providing safe, patient-centered, evidence-based nursing care for chronic and vulnerable populations guided by the Caritas philosophy, demonstrating critical thinking and clinical reasoning when providing quality patient care in community-based settings, communicating effectively with patients, families, and members of the interprofessional team, and managing care for clients and groups in diverse settings. So you want to be familiar with the definitions of emergency and emergency preparedness. An emergency is something that is going to be a sudden, unforeseen event that causes a threat to health or safety. It can actually be either man-made or natural occurring or a combination of both. And then emergency preparedness is the act of making plans to prevent, respond to, and recover from emergencies. Emergencies do typically have three things in common. There's usually little or no warning before the event, available personnel and emergency services that are overwhelmed initially, and a serious threat to life, public health, and the environment. There are four phases of emergency management. They are mitigation, preparedness, response, and recovery. And we're going to be taking a look at each of these and then the relationship of the role of the community health nurse in each of these levels. So the first one is mitigation, and this actually occurs either before or after an event, and it's identifying potential hazards, reducing those hazards, and then minimizing the effects if possible. So the nurse's role, the community health nurse, is primarily focusing on identifying the populations at risk within the community. Have there been previous disasters? What is the community disaster plan? What kind of warning systems are in place? What is the response team, the components of it, and what available facilities there are. So an example of mitigation would be having an early warning system for the sirens for tornado warnings. The second level is preparedness, and this is what occurs before an event, and it's mainly developing a plan. So you're looking at the national, state, local, community levels of involvement and seeing how to develop a plan that's going to effectively be able to manage a disaster when it does occur. So the nurse's role is developing a disaster response plan based on the most probable threats, identifying first responders, defining the nurse's role, and then locating equipment and supplies that will be needed, making sure that equipment is readily available and functioning, and then also evaluating the efficiency, response time, and safety of disaster drills and disaster plans. The third phase is response, and this is mainly the implementation of the plan. It's looking at the greatest good for the greatest number of casualties and actually triaging, providing appropriate treatment, providing first aid, establishing and restoring communication and transportation, what is the probability of infectious diseases and addressing them, and then supporting individuals that need that intervention. So the role of the nurse is going to be activating a disaster management plan, performing that triage, and then coordinating evacuation, opening shelters, and helping manage the volume of people that are going to need to be treated. The last phase is recovery. This occurs after an event, and then it is looking at restoring the community back to the normal functioning level. Communicable diseases are usually an issue during this phase, sanitation control, and then counseling as well because of the post-traumatic stress disorder that may occur depending on the severity of the event that occurs. So the nurse is going to be responsible for those factors, but also providing and coordinating care in shelters, reassessing the health needs of the affected population, and then providing stress counseling as well for the management and emotional aspect. Triage is defined as the process of prioritizing which patients should receive care first, depending on the situation. So, non-mass casualty situation, the nurse prioritizes client care so that clients who have conditions of the highest acuity are evaluated and treated first. Emergency services are presented with a large number of casualties. However, they are still functional and able to provide care to victims on all three levels. So, there's enough resources available to treat everybody. So, it's divided into non-urgent, urgent, and emergent. Non-urgent are minor injuries that do not require immediate treatment and people that are slightly injured. Urgent are major injuries that require immediate treatment, and then emergent are immediate threat to life, critically injured individuals. Mass casualty disaster triage is going to be different. It is where the emergency services are presented with a number of casualties or conditions and are unable to treat everyone. So the staff need to provide the greatest good for the greatest number. And it's prioritized according to these levels. A red tag is an immediate threat to life. Do not delay treatment. Yellow is major injuries that require treatment, delay of treatment of 1 to 2 hours only. A green tag are minor injuries that do not require immediate treatment and can delay treatment 2 to 4 hours. And a black tag is expected and allowed to die. Prepare for a morgue. You also want to be familiar with the disaster zones. This is in your textbook as well, box 46-5, page 2614, and you're looking at hot, warm, and cold. So your hot zone is the most immediate, the dangerous zone. It's in the immediate vicinity of the disaster that occurred. It has potentially toxic effects, so PPE equipment is actually used in all of the zones and recommended, but the hot zone is going to be, you're primarily centered on the immediate area of involvement for the disaster, and it's locating victims, basic life-saving measures, and it's the most dangerous zone. The warm zone is about 300 feet from the area and is usually located upstream, uphill, upwind, so it doesn't become a hot zone. And the main focus is on decontamination of the victims. Cold zone is where it's further away again. Victims are already decontaminated and they're triaged and treated within this zone. In taking a look at bioterrorism, with several attacks that have occurred in recent history, there were two main lessons that were learned, and the first is the necessity of having some knowledge of the agents most likely to be used in bioterrorism events and maintaining a high index of suspicion when confronted by atypical clinical cases. And then also the stress factor, the psychological stress that causes the public to be put on high alert and suspicion, and that this stress has repercussions for the medical system as far as management and transfer of knowledge. We'll be taking a look at these 6 agents that are used in bioterrorism in class in more detail, but I want you to take a look at your table 46-3. It is on page 2615 and 2616 of your textbook, and pay particular attention to the agent that could be used, how to detect if the agent was used, symptoms, how it is transmitted, precautions that would need to be taken, and then if there is a vaccine. And then what we'll be doing is an activity in class where we look in more detail at this, watching a video and completing an additional assignment.